March, toilet paper is king. Mothers use those squares the baby has pulled down hallways and through the legs of kitchen chairs. In March, when toilet paper is king, the children run and run and run outside. A turkey vulture at the peak of the house. Carolina jasmine, yellow, climbing the trees. Beautiful. The scent aloft, mixing with yelps and woohoos. Intoxicating. Midas touch. When toilet paper is king in the month of March.
With the COVID-19, when I first got sick, it was back in the ending of December going into January. And I was sick for like 2.5 weeks. It started with sneezing. From sneezing, I had a cough. Then from a cough, I had a fever. And then I had hot and cold chills, a headache, was throwing up. I couldn't get any sleep. It made me very tired, didn't want to get out of bed. I thought it was just a flu.
I'm going to work, and as the hours go on, I'm starting to feel a little bit weaker and weaker as the hour goes. So, eventually I had to call and leave work early. So I went home after I left, and I just laid. I thought it was like a flu or just a cold. Decided I'd take some medicine myself and doctor myself up, and it didn't work. So I said, let me go to the doctor and see if it's the flu or something worse. So I go and get tested. They wanted to test me because of the symptoms of flu. They told me I was positive with COVID, and as soon as I got that news, I just didn't know what to think because so many people was dying from COVID.
I was at work, and apparently, that's where we think I got it from. Myself and my boss actually contracted it. I was actually what they call asymptomatic.
When you say asymptomatic, that basically means at the time you were diagnosed, you really weren't showing any symptoms of COVID.
Right. At the time that I actually tested, I didn't have the loss of smell or the loss of taste of anything like that. So really, it was just about trying to keep everybody else safe around me.
The symptoms I had, some diarrhea, I had fevers all the time, so I was always having to take some medicine. I couldn't really eat because I couldn't taste. Later on, we found out that my kids and my wife had got COVID, so kids didn't have a whole lot of symptoms from COVID. They bounced back pretty quick. With all the deaths going on with COVID, I feel pretty blessed that my family made it through.
Unlike some of the other stories that you'll hear, I never personally was affected by COVID by having the virus. When the pandemic started in March, I was about 3 months pregnant, and so was pretty much subject to having to spend the rest of my pregnancy alone, quarantined in the house. My son's father was deployed, so to say the least, it was a very lonely period of time. But I figured, I'll still be able to interact with people by doing basic things. Well, halfway through my second trimester, my doctor advised me that due to COVID-19 and the impacts of people of color and the impacts of pregnant women and all of this research that they didn't really have yet, that it would be safe for me to just not leave. It would be better for me to just not leave the house at all.
To the blue-tailed skink of the attic stair, do you expect an apology? You are known for creeping, unseen, and I didn't. That is, see you until your silver belly gleaming caught trickling light from the transom window. You can't be buried, or flushed, or tossed into the gardenia. I need you now. Like the tinsel drape from evergreen in my childhood memory, your tail hangs. Like the white cream exposed after meticulously peeling back the caramel tube of a cowtail candy. Like the opaque, yet translucent mug from Grandma's cabinets when I served more milk than coffee. I think we have always been, here and back then. I won't apologize for needing you now.
The facts are that Black and Hispanic people are way more symptomatic individuals to COVID-19 than any other group of people in our population. African Americans and Latinos are more likely to be in situations that allow them to contract COVID-19 than any other group of people. People of color have high blood pressure, diabetes, and other health problems that make them predisposed to any type of virus, including but not limited to COVID-19. One key to improving equality is gathering more accurate race-based evidence and research on specific groups of people, such as Black and Hispanics.
So since making a full recovery from COVID, they've released a vaccine. Have you heard any information about the vaccine, and are you interested in potentially taking it?
As far as the information, like, that's really the only thing you see on TV right now. Every story I've heard personally has literally been bad. I'm talking, like a couple of my friends said their parents took it and they've been in the hospital ever since. You know what I mean? So I don't know if I'm willing to take that kind of risk.
COVID-19 does not discriminate whether you're Black or white. As far as Blacks being impacted, I just feel that a lot of Black people are scared. They're unaware, and they don't know who to turn to. They don't know if they want to take the shot. They don't know if they should. They're just unaware. They're just uneducated. You know, everyone is scared.
My problem with this vaccine is not that they made it.
I kind of want to see how a lot of people react to it first, because I'm not sure how my body would react. I'm a little nervous of that, but
my problem is how fast it came about. It takes years to develop vaccines.
I definitely don't want to catch COVID again, so if it's going to take me to take the vaccine, then I'll definitely do that.
With the systematic racism in this country, do you think the vaccine that would be administered to quote unquote Caucasians or white people would be different from the vaccine they may administer to Hispanics or African Americans?
To be honest, I can't say, because like I said, in my experience, like, I don't know about anybody else, but the friends that I'm speaking of are actually white. So, you know, I mean, if it seems like they're dying too at alarming rates. So I can't say that it would be just us that they're trying to screw over in this situation. I think it's just like they're trying to kill anybody over that 65 or older plateau personally.
With the way that things are going on in the world, like, you really got to be aware of that stuff. I'm trying not to be ignorant in the fact, you know, the vaccine is there to save lives, but at the same time, I just can't not think that, you know, with the way things are going on, especially with African American people and Hispanic people, that it is some type of conspiracy going on with that. So I'm just taking my time with the vaccine, and, you know, eventually I'm sure I will.
If you are a 65-year-old woman who eats fried foods and have high cholesterol and high blood pressure, and you are a Black woman and you contact COVID-19, the facts are that you are probably less likely to do well in getting better or get better slowly.
I feel that we should wear the mask.
Wear your mask whenever you're out in public.
People, I understand that we're tired of wearing masks. I understand that. Please just do it so we can try to get past this. You know what I mean? Like, don't get mad at your clerk at the gas station because they ask you to put a mask on. It's part of their company policy. It's not nothing that they're trying to do to piss you off. And like y'all, a lot of people really have to stop doing that, man, and understand that it's people trying to do something to keep people safe.
Always wash your hands and keep hand sanitizer with you and use it frequently as long as you're out in the public, especially.
But I feel like a lot of people will catch the virus. It will affect different people in many different ways.
COVID is very serious. It's 400,000 people dead from COVID. So you definitely got to take it seriously.
Just like any other virus or disease, COVID-19 is not disproportionately affecting Black people because it's COVID-19. It's disproportionately affecting Black people and all people of color for that matter, but specifically Black people because of the environments that we're in. If you have low access to healthcare, if you have low access to resources, if you live in housing that is overpopulated in a small circumference of area, for example, if you live in the projects or a trailer park, all of these things make you pre-exposed and more likely to contact the virus and die from the virus simply because of your living conditions. If we fix other problems, we could fix the effects of COVID-19 in the Black community.
Can be worse. You were the first love. We shared a black room. She brought a flash through. Who invited her? 5 syllables. Never let you go. 4 words you told when you sold your soul. 3 spelling out the L-I-E. 2 for the future we both dream. 1 for the day when you slipped away. And I was wishing for better days. Better days. Can be worse. You were the first love. We shared a black room. She brought a flash through. Who invited her? 5 syllables. Never let you go. 4 words you told when you sold your soul. 3 spelling out the L-I-E. 2 for the future we both dream. 1 for the day when you slipped away. And I was wishing for better days.